You always want to use the 6 rights of medication administration. So you want to have the right patient, the right medication, the right dose, at the right time, the right route, and the right documentation. So I'm going to wash my hands. I'm going to look in my physician orders and my medication administration record. There is Rocephin 1 gram intramuscularly every 12 hours for 6 days. Use Z-Track for administration for my patient Skip Rocker. So I'm going to go in the medication room and find my Rocephin. It needs to be reconstituted. So the strength can either be 300 milligrams per milliliter, 400 milligrams per milliliter, or 500 milligrams per milliliter. The dose that is ordered is 1 gram, so 1,000 milligrams. So the easiest way to reconstitute it would be to do the 500 milligrams per milliliter. And to reconstitute this, you need 5.6 milliliters of diluent to be added to this. Some will specifically ask what kind of diluent you need. For this one, I'm just going to use the 0.9 sodium chloride. So the first thing you're going to do is you're going to clean the caps of both of them. I'm going to get everything ready. So this is a 6 milliliter because I need to draw up 5.6 milliliters of the diluent. And this needle should do so what you want to do is draw the air out of your medication vial. And you're going to draw up 5.6. And then you can take it out. And then you're going to inject it into your diluent and insert it in. Flip it upside down and pull out the 5.6. Or 6. And I'm just going to check that it's 5.6 again. Okay. And you want to clean the top of your medication. Oops. Clean the top of that before you inject it in. Then you're going to put this in your sharps container. You're going to roll it. You don't want to shake it until it's all the way dissolved. You don't want any big chunks or anything in there. Okay. So once it's all the way dissolved and you can't see anything else in there, it's clear, no big particles, you are good for that. So if you need, since we need 1,000 milligrams or 1 gram of the Rocephin, we're going to use 2 milliliters out of here because that's how we reconstituted it to the 500 milligrams. So we're going to need to draw up 2 milligrams. So going to clean the top of this one more time. Okay. And we're going to use a different needle to draw it up than the needle that we're going to use to inject our patient with. And this is a 3 mil 22 gauge. Okay, so without touching these things, we want to maintain sterility. I'm going to lock it on, pull it out. You're going to want to inject the 2 milliliters of air in. We already cleaned the top of this, so that's good. Going to get in. Oh wait, you put the air in, then you flip it upside down. Going to pull out 2 milliliters. Okay. Alrighty. And so we're gonna scoop this up one-handed. And we are going to get rid of this needle. Nope, that didn't work. There we go. I want to put this one in the sharps container. And so we're going to pick the needle used for the site that we're going to inject. So this one has the 3 mil 22 gauge. And the needle we're using is the 1.5 needle. And it has a safety pump. Okay, so now we have our medication, and we're gonna make sure that we marked on here before we leave that we reconstituted it with the 5.6, so it's the 500 milligrams per milliliter. We're gonna take this to our patient's room. Gonna knock on the door, introduce myself. Hi, I'm Abby. I'm gonna be your student nurse today. I'm going to do 2 patient identifiers. I'm gonna look at the wristband, ask them their last name and date of birth. Going to explain the procedure. So I have 2 milliliters, I have 2 milliliters of the Rocephin intramuscular injection to give to you. So for finding the sites, if we had a ventrogluteal site, you can either have your patient standing or lying on their side. You want to use like your left hand to the right hip or your right hand to the left hip. So if we have, this is our patient and their hip here. With your thumb, you want to feel for the greater trochanter, which you can kind of have them pick up their knee and look for. And then you want the top of these 2 fingers to get the top of your iliac crest. So then you're going to spread your fingers out like a V. So you have your thumb, the V, and you're going to go right in the middle of the V that you made. And if you're doing the vastus lateralis site, you can either have them sitting or laying supine. And you want to use the middle third of their thigh. So if you just kind of chop into thirds, you can use that middle third kind of on the lateral side here. Okay, so what we're going to do, we're going to put on gloves. And then we are going to clean the area with an alcohol wipe and allow for time to dry. So on the prescription, we're going to be using the Z-Track method. So what you do with that is you can, kind of use your hand and you're going to push their skin and everything off to the side about 1.5 inches. So just kind of move everything over. And then we have our site that we found earlier. We're going to want to do that right in the middle. And you want to dart it, kind of like a dart or a pencil. And so we have everything pushed over, we have the site, we're going to go 90 degrees. And you want to insert the needle fully. So this is where you could check for you want to aspirate for blood, make sure you're not on like an artery. So you're going to pull back and aspirate for blood. If you see blood, you need to take your needle out and start over and drop new medication. We don't have any blood return, so we're going to go ahead and inject our patient. You want to do it slowly over 5 to 10 seconds. You're going to remove it quickly and smoothly, and then you're going to allow that skin, you're going to release the skin and allow it to go right back over where it was. You're going to put this in the sharps container. And then we're going to check our medication administration record. And we're going to document that we gave the Rocephin 1 gram intramuscularly. We used the Z-Track, we're going to do the time, the date, and we're also going to note the site that we used, which was the left hip of the ventrogluteal site. Have it there. And then in our narrative notes, they tolerated it well, and we used the left ventrogluteal site, and the Z-Track method was used.